So Nanette, you have been attending in the clinic at Grady. We have shared stories about some of the wonderful relationships that we have with our patients. Tell us a little bit about that.
Well, part of what has differed in recent years, and I'm really trying to go back to the past a little bit with it, is we have so much objective data, laboratory data, imaging data, biometric data, et cetera. And that really has helped us in the care of the patients. But we can't lose sight of the basics of clinical medicine, and that is the history and the physical examination. These are basic skills. They may not be as exciting or as exotic as some of the new testing is, but that is the basis of patient care. And the important feature is listening to the patient, asking some of the open-ended questions, and then asking, is there anything I didn't ask you that you want to tell me? Because as you put this together, you must frame it as the patient sees it. Now, you may decide some of that is important, some of them is not important later on, but the importance is seeing why is it the patient is coming to see you. And very often, I will ask, or I will teach my trainees to ask, what do you want to accomplish as a result of this visit? And some of the patients will say, I just want my medications refilled. Some of them will say, I want to know the results of the test. But very often, if you probe just a little bit and say, what about you? Are you doing everything you want to do? Is there anything we can do to help? Then you will get some additional information. And then the physical examination skills become critical. We no longer automatically order a battery of tests, but it is the history and the physical examination, the relationship with the patient that guides this.
Yeah.
And I think you've heard me tell this story. I have patients whose first language is not English. Some of them are not English speaking at all. But I have two gentlemen who came to me decades ago with chest pain syndrome that I thought was really serious, non-English speaking, having to use a translator, and I carried them through an exercise test, a cardiac catheterization, the need for surgery, and for one of them, who agreed to surgery, provided I would hold his hand until he fell asleep. So I had to scrub and go in holding his hand. And this gentleman, every time I see him in the clinic, jumps up, gives me a great big bear hug. And the translator now on the video machine, I hear her saying, that's wrong. And I said, no, it's all right. We're old friends. But these are the things where you have contributed some of yourself to the care of the patient. And I think that becomes important.
Yeah. Relationships really are the key. A lot of us go into medicine to be able to serve people and to be able to have that relationship over the years. And, prevention is my passion. And so when I pick up people who have really high cholesterol or familial hyperlipidemia, or I pick up, somebody early in terms of their hypertension and go ahead and start management and meet them halfway, hear what their concerns are and how I can get them to take their medications and have that trusting relationship so that we can really alter their trajectory. I mean, that's the one exciting thing about cardiovascular medicine is that a lot of it is, lifestyle and prevention, like you've mentioned.
This is one of the things we were talking about before, that everything that we do, whether you're working in a basic science laboratory, in a clinical laboratory, in a translational laboratory, in education, everything is directed to improving the care and outcomes for the patient. So this is patient-centered education, research, and clinical care. And every contributor and every contribution becomes an important building block in making that a success.